Hi, I'm Dr. Chris Salerno. Welcome to another Thursday Troubleshooter, where we attempt to address some of your toughest questions. We have a tough one for you this week. Dentist writes in, a 15-year-old patient comes into the practice with her mother for an exam and a cleaning. Her mother explains her main concern is her daughter's discoloring teeth. The mother would like to see the teeth, and I'm quoting here, chalky white. The patient does not express a desire to have whitening. That's important. Seeing as the mother is giving consent, is there any legal obligation to perform the treatment or to not do treatment? It's a very tough question. When dealing with a minor, when dealing with someone under the age of 18, in most states that I'm aware of, we do have to look to a legal guardian to make decisions based on their care. Now, the difference for me here is whether or not the treatment that we're discussing is medically necessary. If a child needed to have a pulpotomy done or an extraction done to relieve them from infection and pain, I could imagine, I think we all have patients, children patients who don't want to have that done, but it's medically necessary. And so we've explained it to them, and we've most importantly explained it to the caregivers, and the caregiver and the dentist agree that this is treatment that should be done, despite the fact that the patient's not going to be too happy about it and may protest, especially the younger patients. So that's a case where we do go beyond the desires, the will of the patient, but because it's in their own best interest and it's medically necessary treatment. In this case, the treatment that we're discussing, bleaching, is not medically necessary. It is absolutely a cosmetic procedure. And I'm glad that you did ask the patient what their desires were. You ascertained that the patient does not want to have them whitened. That's a tricky thing. That may even be something that you have to ask with the parent, the caregiver, not in the room. Maybe that child feels uncomfortable disagreeing with their parent not in the room. But you've already accomplished that. You found out the child doesn't want to have this done. In my opinion, this is my opinion, I think we have to follow the ADA's code of ethics. Principle number one is patient autonomy, is respecting the self-governance of patients. And in this case, because it is not medically necessary treatment, I think that there's no reason that you should feel comfortable proceeding with bleaching these teeth. You certainly do not have a legal obligation to whiten this child's teeth just because the parent wants you to do so. And that's the important distinction that you were asking. So a tricky question, and we could certainly think of some different permutations that become more complicated. What I would advise you to do, if you ever have really challenging questions like this that get into even some private details, is to consult with your local dental society. Your local branch of the American Dental Association can help you interpret these rather tricky legal questions.